Guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, if you're joining us for the first time, please consider subscribing. Guys, when you subscribe, you might not be you might not get anything by doing that because you have access to the content anyway, whether you subscribe or not. But you subscribing, you're actually helping me. So please guys, please subscribe and please share, like, comment and all of that. It helps my channel to grow. All those things I've mentioned, subscribing, sharing, commenting, liking, those things, they actually help the channel to grow. Maybe one day I will sit and explain how does that help me. So if you like my content and you want to support the channel, you want to support me, simply just subscribe and like. Thank you so much. For a couple of weeks, so for some time I've been away, I haven't been able to actually create content and upload, and that's because of work commitments. As much as I do this, I need to make sure that me creating content and all of that does not actually come in and interfere with what I'm employed to do, which is to take care of patients. So yeah, so it's been hectic. I haven't been able to upload anything. I think it's been about 7 or 8 weeks now. So my apologies for that, but it's something that is just beyond my control, my abilities and all of that. But anyway, in this video guys, I just want to, people have been asking me, I've been meeting people have been sending messages asking me, Dr. T, how has ComServe been for you? How's your experience, and what are the tips that you would share given an opportunity? What are the things that you, because people that have been sending me messages are people who are doing second year, they are doing their second year of internship. So it's people who are gonna be ComServes next year. So these are the people who have been asking me to share what are the crucial things or that they need to learn, and what are the skills that they need to actually have before they can start their ComServe. What are the things that will actually help them to be able to cope better with ComServe and all of that. And some people don't even know what ComServe is and all of that. So what I'm gonna do in this video, I'm gonna start from I'm just gonna say, let me put it this way: how do you become a medical doctor in South Africa? I'll briefly talk about that. So how do you become a medical doctor in South Africa? Obviously you're gonna go and do your high school. After your high school or your matric, whatever that is equivalent to that. So after you've done that, you're gonna do your undergrad, which is your MBCHB. You're gonna do that for, in some universities it's 6 years. The only university that still does the 5-year program is the Free State, UOFS, or the University of Free State. That's the only university that I'm aware of that still has the 5-year program. But all the other universities, they have, or they do, the 6-year program. So I studied in Pretoria and I'm a product of a 6-year program. So whether you do your 5 years or your 6 years, depending where you're studying, after that it's what's the word? So you're gonna do your 2 years of internship. So whether you did 6 years or 5 years as an undergrad, you will still do 2 years of internship. So if you did 6 years, because this is another thing that usually confuses people. So if you have done 6 years, your MCHB program, you did 6 years, doesn't mean that your internship will be less in terms of the year. It will be the same. So after you have graduated with your MBCHB, everyone will have to do 2 years of internship. I know previously it used to be a year, but that was like long time ago. But right now everyone does 2 years of internship. In that 2 years of internship, you are a doctor, but still you are under training. And you can't, there are things that you can't do, and there are things that you can do. So you are still, you'll be registered with the HPCSA, but you'll be working dependently. So you are still a dependent practitioner. You're not an independent. So you still work under supervision, right? And as an intern, you rotate through different departments. What I wanted to stress is that whether you did a 5-year program or a 6-year program, the internship is just standard for everyone. It's 2 years in South Africa. That's what I wanted to stress and make you guys to understand. Then after that, so in that 2 years, you can't specialize. In that 2 years, you can't open a private practice. In that 2 years, you have to rotate. In that 2 years, there are so many things that you can't do. You can prescribe, and pharmacists will dispense your medication, but they will be strict. They will look at your medication. They will scrutinize your medication. But if you're prescribing the common things, amoxicillin, brufen, diclofenac, augmentin, those things, but when you are prescribing drugs that are at a very high level, or they are not your common drugs, they will look at them and they will scrutinize. But when you have prescribed and you have put all your details there, and there's nothing fishy in your prescription, there's no one who's gonna say anything. But as we all know, when you prescribe whatever, you have got to discuss that with your senior. It just depends where you are and all that. I don't want to get into the details because it varies from place to place. And also, yeah. So after that 2 years, you have to do it in an academic hospital. You can't do it in a level 1 hospital or in a district hospital. You can't do that entire 2 years there. I know now for family medicine, you do go to a level 1 for that 3 months, a level 1 hospital or a district hospital. Maybe one day I'll have to talk about the healthcare system in South Africa, because now district hospital, teacher hospital, level 1 hospital, what are those and all of that, and how do they fit into the entire healthcare? Because you need to understand the healthcare system of South Africa, because you'll be a doctor working in that healthcare system, right? So after the 2 years, you have to do 1 year of ComServe. It's called community service. You become a community service medical officer. So it's only 12 months, and it's also one of the it's a must that you do it, just like internship. It's a must that you do it. I know previously I've heard that after your internship you are done, you could go and specialize and do whatever, but the extra year called the ComServe year, or the community service year, was added apparently because the government wanted to force people to go to the rural areas to go and do community service, ComServe. Hence we are called community service medical officers. So we have to work to give back to the community, go to the rural places and all that. So by definition, as a ComServe, you should not work in a tertiary hospital. There shouldn't be posts for ComServes in a tertiary hospital. We are supposed to go to level 1 hospital or the clinics or district hospitals. But I know there are people that somehow they get post in a tertiary hospital from internship straight into, it's not something that is supposed to be happening, but it's happening. I don't want to get into the details of that as well, because I don't understand how it happens and why it happens. So, but we see it there and there, but it's not a common thing. Most people, for their ComServe, they go to the clinics and level 1 hospital, healthcare centers and all of that. So in that year, you can't specialize again. You can write primaries for some departments, and you can do your courses. Even in internship, you can do some courses, 1-day courses, like your BLS, ACLS, PALS and all of that. You can do those courses. I'm not sure if you can do, I don't think you can do the HIV diploma during your internship, but I'll have to double check. But during your ComServe, you can do your HIV diploma. and write that and have your certificate. So yeah, that's that. Now, as you all know, I have done my 6 years of undergrad, and I've done my internship, and I was in an academic setup. I did my 2 years. Now I'm a community service medical officer. So what have I been doing as a ComServe doctor or a community service medical doctor? So just like it's supposed to be. So I've been placed in a level 1 hospital. So in a level 1 hospital or a district hospital, I mean, guys, personally, I wouldn't want to finish immediately. I finish my internship, I go in and specialize or go to a specialized department. I wouldn't want that. The experience of being a ComServe, personally, I think it's very important. That's where your confidence grows. That's where you sort of like start to feel like a doctor. That's where you start to make decisions on your own. That's where you start to do complicated procedures that you never did or you were never given an opportunity to do during your internship. That's where medicine just starts to make sense during your concept as a doctor. I mean, I wouldn't trade these 12 months. I've done 8 months now, but I wouldn't trade it for anything. I wanna go and specialize one day, but the ComServe here for me, I feel it has accelerated my growth as a medical practitioner. There are a lot of skills that I've learned. There are a lot of like my clinical acumen has improved. The way I manage patients, there's a lot that has improved. So I wouldn't trade it for anything. So I would advise you guys, don't be like a lot of people that I know that would just want to move from internship, then they go straight to a specialized department and become specialists. Because they're like, why should I waste my time and go to a general hospital when I can get a post in anesthesia because I want to do anesthesia? Trust me, there's always be that thing in you that is always lacking, that will forever lack because you never did your ComServe. ComServe, it gives you, I don't know how to describe it, but it gives you this confidence. It helps you to grow as a practitioner. It exposes you. I think that's what I've been looking for. It exposes you to a lot of conditions, to a lot of different conditions. It exposes you to a lot of different age groups, patients with different medical conditions, and all of that. And the other thing that I appreciate about being a ComServe is that, remember, when patients come to patients usually they come to level 1 hospital before they can be sent to tertiary hospitals. So which means whatever that you find, so you get patients straight from the community, and then they come to you, and you are the one that will pick up that diagnosis and refer the patient to a tertiary hospital that you refer to. Remember, as an intern, the patients that you managed, your appendicitis patients that you managed, are patients that were seen by a doctor at the level 1 hospital. They were managed and they were referred. So whatever that you find, 90% of the times, whatever condition that you find as an intern in your tertiary hospital, your academic hospital, it's a patient that has been worked up. It's a patient that has got a diagnosis already, that is just coming because they just need specialized care. But getting a patient from the community, then they come to you, and then you are the one who actually makes the diagnosis and be like, this has got to go. And you even get doctors from the other side sending you messages and be like, hey, it's a good thing that you referred that patient. That's what that's what builds your confidence. That's what makes you to grow as a medical practitioner. I mean, if I get a patient, if you refer a patient, let's say I work at a tertiary hospital, you refer a patient to me with, I'll again make an example of appendicitis. It means you have examined the patient as a doctor that side, and this is the diagnosis. And when I come and assess that patient, when you refer that patient to a tertiary hospital and I come and assess that patient, you have already told me the diagnosis, so I already know the diagnosis. As much as I'll still assess, but I mean, there's nothing. I mean, it's different to be told that a patient has got appendicitis. It's different from having a patient from home who's complaining of an abdominal pain, because an abdominal pain can be anything. It can be anything. So you don't become narrow-minded. You think outside of the box when you're at a level on hospital. So that's the experience that I'm talking about. It's so beautiful. It's so nice. Obviously, it's not something that you want to do for the rest of your life, but because you are here now and you have to be here, you might as well enjoy it, because it's not you're actually growing and learning, right? So yeah. So now I'm gonna zoom into my experience as a ComServe. So I've been now in this hospital for 8 months. So September is my 9th month. So I've been here since January, and it's a level 1 hospital. One thing that you're gonna have to understand and appreciate about level 1 hospitals or district hospitals is that there is no specialist. If you are lucky to find a specialist at a level 1 hospital in South Africa, it would be a family physician. And I'm not talking about specialists that go and have or hold some workshop or outreach at your hospital. They are not stationed there. The only specialist that you can find stationed at a level 1 hospital is usually your family physician, but you can't find an obs and gynae, you can't find a general surgeon, you can't find a neurologist, you can't find specialists in a level 1 hospital. So the doctors who work in these hospitals are doctors that are not specialists, they are GPs, so they are general practitioners. And the difference, so everyone who's in this hospital has got an MBCHB. Talking about doctors, we all have an MBCHB, and the difference is the experience. You've got your ComServe and your grade 1 medical officers and your grade 2 medical officers. We don't have grade 3 medical officers here, as far as I know. So let's go back again. So you are an undergrad, you do your 6 years or your 5 years, you do your internship for 2 years, you do your ComServe for a year. And then from that, when you have done, or when you are done with your ComServe year, you become a medical officer grade 1. And you're gonna be a medical officer grade 1 for about 5 years before you become a grade 2. So you become a grade 2 from your 6th year to your about 10th year of working. And that's after ComServe, right? So the first 2 years of internship and that year of ComServe does not count. So you start counting as your medical officer grade 1 after your... So next year, I will be a grade 1 medical officer next year. So the post that I'll be looking for next year is a grade 1 medical officer. So I'll be that for about 5 years, and then from there, after 5 years, I become a grade 2. And then anything above 10 years is a grade 3. But what is happening now, people are specializing. They don't wait for that kind of progression. And all of that. So yeah, so that's what we have. We all have MBCHB here, and we differ in terms of experience. Like I said, we've got ComServes, we've got grade 1 medical officers, and then we've got grade 2. There are people that have got short courses like BLS, ACLS, PALS, and all of that. There are people who have got that, but the main thing that we have is the MBCHB. So now maybe ask yourself, what do we do? Okay, let me just go back. Most district hospitals, the services that they render, like in my hospital, you have your accident and emergency department. You have, so we have a pediatric ward, we've got maternity ward, we've got male medical, male surgical, female medical, female surgical. We also have so we've got an outpatient department. So it's like a polyclinic. That's one of the things that that's one of the major differences when you compare a level 1 and a tertiary hospital. So our clinic, we see everyone and everything there, all conditions. I mean, when you're a doctor consulting in OPD, right now you might be seeing an ortho case, then the next patient that comes in, the next one on the queue is maybe a pediatric with maybe HE or some pneumonia or seizures. Then the next patient after that, it's an 86-year-old with hypertension, CCF. The next patient that you see is maybe a 15-year-old with rheumatic heart disease. Then the next patient that you see maybe is a psychotic patient, is on treatment, is for review. The next patient that you see is a patient on antiretrovirals. So that's our polyclinic. We see everything there. And then now, when you have, so it's like what we do, like GPs are people that triage. So guys, this is different from tertiary hospitals. In the academic centers, an MOPD is purely for medical patients, a medical outpatient. An OOPD is an orthopedic outpatient. You only see orthopedic cases there. POPD is just pediatric OPD. That's different from what we do here. So we've got everyone in our OPD. It's like like I said, it's a polyclinic. We see everyone and we decide who are we sending back home, who are we admitting, and who are we referring to. Those are the questions that you must just ask yourself. So all the patients that you see at a level 1 hospital, there are those that you will make a decision to discharge home. There are those that you will admit because you know that you can manage them. Then there are those that you will have to refer, right? Like I said, this is different from your specialized clinics, right? Now, in these hospitals, you don't have obstetrics and gynecology, you don't have a pediatric department, you don't have a general surge department. No, like I said, we've got a surgical ward, and in a surgical ward, you have, if it's a female surgical, you've got, so the patient that you admit then are females with any or all surgical conditions are admitted there. If it's a female, a female medical, you admit all females that's from 13 years going up that have got a medical condition, so they go in that ward. So when it comes to pediatrics, so you must be 12 years and less to qualify as a pediatric in my hospital. That's the definition that we use. That's the range that we use, age limit that we use. So they are all in one ward. Doesn't matter whether you've got, there are some isolation units there, but we admit burns there, we admit infections there, we admit if you've got a surgical patient that doesn't need operation, whatever, it's an abscess, whatever, you can keep that patient there as long as you know that you'll be able to manage the patient. And then when it comes to maternity, it's not called obstetrics and gynecology, it's just maternity, because there, the patient that goes there are patients that are pregnant and they must be 22 weeks and above to go to that ward. If you've got a gynae problem, you'll be seen at the polyclinic. Then if they admit you, they'll admit you in female surgical, if it's a surgical condition, female medical, if it's a medical condition. We also do have an MDR unit, and we also do operate. The only operation that we do is the cesarean section. So there are some districts that do appendectomies. There are some districts that do debridements. It depends on the level of experience, who is there, because there are medical officers that would work in a department at a tertiary hospital for years and then go back to the district. Those people, they are used to whatever that they will be doing, so they can do your appendectomies. But in my hospital, the only operation that we do is a cesarean section. So yeah, briefly, that's how we work, and that's the setup of a district hospital. And for my internship, family medicine rotation, I went to another hospital which is about 3 hours from my hospital where I'm working, and the setup is just the same. There isn't any difference, right? So now, guys, In the next video, I will zoom into my own personal experience, what has happened with me or to me since January until now. So please stick around for that. I hope you guys are giving you some good insight, and that by the time you start your ComServe, you understand exactly what's going to be happening to you or with you. And also I hope that guys, I hope that this video will help you to understand the healthcare system a bit and all of that. I know I've got people that have subscribed to my channel that studied in China, and some in Russia. So the healthcare system, they don't really understand it. And also I'm gonna get someone who's gonna talk to you guys what happens, because I understand that when you come from China or Czech Republic or Russia, you have to sit for board exams. I'm gonna get someone who's gonna help you guys with that, because I don't really know what happens with your exams and all of that. So before you can be an intern in South Africa, you have to write the board exams. But if you studied in South Africa, you don't sit for board exams. Okay, hope you guys like that.